There are several hormone systems within our body, and imbalances in any of these systems can affect each of the other systems. First of all, when we think about hormones, it all starts in the brain. There's a little 1.5-inch area of the brain called the hypothalamus, and that is the control center of the brain. So that's where hormone balance begins. And that is where signals come to our pituitary gland. And the pituitary gland is like the mother gland in the body. That's what tells all the other glands what to do and how much hormone to release. The pituitary gland then signals to each of the other glands in the body to make whichever hormone is needed. For example, the pituitary sends a signal called TSH to the thyroid gland to make thyroid hormone. The pituitary sends a signal called ACTH to the adrenal glands, which sit right on top of the kidneys, and those are our stress glands, and they help us respond to and manage stress. And the ACTH causes those glands to release cortisol in the body. The pituitary gland signals the ovaries to make estrogen and progesterone through several different signals. In addition, it signals in men to the testes to make testosterone. So those are several of the hormone system in the body. The pituitary gland also releases growth hormone, which in adults helps us to heal and restore and repair tissues and is released during deep sleep at night. So finding out which hormone imbalance is causing a problem in an individual can be a complex procedure, and it starts with asking about specific symptoms. So I will have patients fill out a questionnaire in which we've separated the hormone problems and the symptoms into different hormone areas, so that often I'm asking the same question twice because that same symptom could come from several different hormones. In this way, I can easily tell which hormone systems are most likely to be causing the problem in an individual patient. Then after an examination and laboratory testing, then we can see where hormones may be needed. For example, thyroid hormone is really our baseline energy and metabolism hormone. That's what runs the body. Every cell of the body needs it. It actually goes into the cell and turns on mitochondrial energy production. So that's where energy in the body comes from. So if thyroid is low, whether it's low from not getting the correct signal from the pituitary gland, whether it's low because the thyroid gland is sluggish, either because it's been removed or there have been antibodies that have been attacking it as in autoimmune thyroid problems, then patients can have symptoms of weight gain and low energy and fluid retention, constipation, just overall sluggishness. One of the reasons physicians may often miss thyroid problems is sometimes the problem is not with thyroid production, but how it's processed to its active form in the body. Thyroid can be processed to its active form, which is T3, or it can be processed to a thyroid blocking hormone that's called reverse T3 that actually stops thyroid from being able to get into the cells and tissues and turn on energy production. So it's impossible to say whether there is or isn't a thyroid problem until you've checked thyroid in all of those ways. The adrenal glands help us respond to stress. So deficiencies in adrenal hormone production can lead to sugar cravings, low blood sugar, low blood pressure, anxiety and feeling overwhelmed in response to stressors that 10 years ago you could handle just fine. So testing the adrenal glands is very important. And with the adrenals in particular, it can be very hard on blood testing to pick up an adrenal gland problem. And the reason is because most physicians are trained to only consider abnormal lab tests that fall outside of the reference range that's given to us by the lab. And what we have to remember about testing is those reference ranges are based on statistical norms, not on health and wellness. So a lab will take 1,000 patients or 1,000 people, test them for a particular hormone, such as cortisol, and they call 95% of them normal. For those of you who know statistics, that's 2 standard deviations from the mean. So only the very few patients, or 2.5% of people at the bottom and top of that range, are considered abnormal. What I have found through my experience with patients is that when you cross that line, say the lower end of that normal range is 6, it's not like if you're at 6.1 you feel great and you're at 5.9 and all of a sudden you have symptoms of low adrenal function. Those symptoms can occur anywhere on the lower half of that range. So it's important to consider more optimal ranges that are closer to the mean or the middle of that range as we're treating hormones. Estrogen and progesterone in women are imbalances in these can cause problems from as early as the first onset of a period through childbearing years through the time of menopause. And very often it's not the actual level of hormones that's the issue, but the balance between estrogen and progesterone. For example, many PMS symptoms such as fluid retention, bloating, irritability, breast tenderness result from estrogen being out of balance with progesterone. So too much estrogen, not enough progesterone. And very often using progesterone can alleviate some of those symptoms, or may alleviate some of those symptoms. During the time of menopause, of course, estrogen and progesterone levels start to decline, and may actually decline in a more jagged fashion rather than just going down. So it's important to find a physician who can work with you to adjust the doses as your levels change. Typically when I'm replacing estrogen and progesterone, I'm using bioidentical forms of these that match the hormones that the human body would make. Therefore, there's no real side effects, and they're not really drugs. They're hormones that you can experience symptoms of too much or too little, but no real side effects. And you get all the beneficial effects of having those hormones in your body. The same with testosterone in men. You know, we're looking to optimize levels, not to have it too high or too low out of the range, but for men that can often help with, you know, symptoms of fatigue and pain and sluggishness, even depression, when workouts aren't, you know, creating the same results as far as muscle mass. Very often we'll detect slight decreases in testosterone levels, and giving testosterone can help restore that vitality and more youthful feeling. So that's a basic overview of a lot of the hormone treatments that I do and how I interpret those tests and treatment differently than many other physicians.